She is fully weight-bearing, not in pain, walking with a Zimmer. Was to be there for up to 6 weeks to give me time to find a residential home, and not a day more.
After a hip operation in 1998, and despite her advanced years, Gillian Mackenzie expected her 91-year-old mother to make a strong recovery. But shortly after, Gladys Richards was admitted to Gosport War Memorial Hospital, and after another fall, she began a course of painkillers. A coroner later found these contributed to her death.
The drugs were totally inappropriate on the day she arrived at Gosport.
The administration of these painkillers appeared to be routine for many patients. These ranged from those likely to need palliative care in the final stages of their lives to those, such as Gladys Richards, who had high hopes of making a good recovery after rehabilitation.
Dr. Barton has written up: impression, frail elderly lady, demented, not obviously in pain. Please make comfortable. I'm quite happy for nursing staff to confirm death. She was saying she's dying.
The role of Dr. Jane Barton has been examined by the panel. In 2010, the General Medical Council found her guilty of serious professional misconduct after it concluded that she had overprescribed potentially hazardous levels of drugs. Dr. Barton was not struck off, and she chose to retire after the findings. She has previously denied wrongdoing and has maintained that she always acted in the interests of her patients. On the 20-year journey to the publication of the inquiry, the families have endured multiple investigations which appeared never to reach definitive conclusions. Police launched 3 investigations between 1998 and 2006, but each time the Crown Prosecution Service decided not to pursue the matter. In 2009, inquests were held into 10 of the deaths. A jury found that drugs were a factor in 5 of the cases. In 2013, a full 15 years after the death of Gillian Mackenzie's mother, a coroner made a similar finding in her case. The conclusion of the inquest was a defining moment for the families. Now that the inquests were over, an official report into the deaths could finally be published 10 years after it was first submitted. The report found that opiate painkillers had almost certainly shortened the lives of some patients. But the battle for the families was far from over.
It's scandalous how long they've had to wait. This goes back to the early 90s, and the sense that families just felt completely ignored for so long, I just think is horrific. And there has been a real systemic failure here, a closing of ranks in my view.
Norman Lamb campaigned on behalf of the families in opposition. Then in 2013, as a health minister, he had a chance to shape the outcome.
I asked to see the Professor Baker report, and for 2 to 3 months it wasn't forthcoming. We then went away on holiday in the summer of 2013. Late at night one evening, I just happened to switch on my iPad and I saw an email from my private secretary which said that they were going to publish the Baker report the next day and that they would announce that there would be no public inquiry. And I was incandescent about this. I immediately sensed that there might have been a conspiracy to cover this up whilst I was out of the country. To this day, I don't know whether it was cock up or cover up, but I was very clear in my mind that there must on no account be that statement made the next day.
Tomorrow morning we'll know the results of the inquiry instigated by Norman Lamb. For the families, it's been a long wait to find out the full story behind the deaths of their relatives. The delay has only served to fuel suspicions.
I'm convinced there is a cover-up to begin with. And I'm going to do everything possible to see that cover-up doesn't continue.